here for the MyEllevate procedure. So I was looking online and I was following another doctor and his social media page, and I made an appointment with him, consulted with him, and he had mentioned that there's probably 3 options for me because I'm in that in-between stage where I don't need a full-on neck lift, but just something a little bit tighter to make it a little bit more snatched looking. And upon the consultation, he had mentioned that there's probably 3 different procedures that would be okay for me. One, a laser procedure. The second one, MyEllevate, and he said that if I were to get it done, it would be with Dr. Mueller because he's the best. And I immediately knew that this was the right procedure for me, or the lift. But I immediately called Dr. Mueller after my consultation. They were able to squeeze me in, and I immediately felt so comfortable with Dr. Mueller, and I knew this procedure was going to be the right one for me.
So we are getting ready to go for our MyEllevate case, and our patient here is all ready. And what we're going to do first is I'm going to mark the bands, and I'm going to have you just sort of flex your neck muscles if you can, make that funny look. There we go. And this is a platysma band right here. And what we do is during the procedure, we make a tiny little cut in this band right here. And it makes it so we can just tuck that right up there to really make it nice and smooth. And she's got another one over here. So we're going to just go ahead and mark that one as well. And we do the same thing. So we're going to just, these little dots are places where we place the instruments that go in and make a tiny little cut in these bands. So we're going to go into the operating room, get you all comfortable, and I'll be injecting some numbing medicine here, as well as underneath the chin and along the jawline and behind the ears, and then we'll get going. It'll be about 1 hour. Perfect. Are you all ready to go?
Yeah, I'm ready. Let's do this.
All right, we're going to head down to the OR.
This is probably my most favorite part of the operation, is doing the planning. That means everything. What I do is I use the OVO 360 images as well as the patient's history to really come up with a great treatment plan. So you can see as she's rotating, you can see she looks pretty good as she looks straight forward, but she's got some wrinkles here along her neck. We're going to use laser to address that. Then you'll see this next view where she's smiling. You see a little bit of the platysma banding, and you see a little bit of an area underneath the chin, sort of a little bit of fullness there, and MyEllevate will lift and shape that to give her that snatched jawline. And this next view, where we have the patients look up, gives me a great idea of the jawline contours. I can see a couple little fat deposits that they missed with the liposuction before, so we're going to take care of those today as well. And this last view here, with her looking downwards, really shows how she's got that area that is not supported underneath the chin. And this is where MyEllevate is the golden solution to lift and support that area. She also has a little skin fold that the laser will help sort of shrink wrap that skin. And here are those platysma bands. This is the crux of MyEllevate. What we do is we make a little cut in the front edge of those to help minimize the appearance. So we're going to head to the OR. I can't wait for you to see the results. We just finished up and I'm so happy with our results. Everything went great. Today we did division of the platysma bands as part of the MyEllevate procedure. We did a little bit of laser with Precision TX. That's our energy-based skin tightening technology. And then we placed the beautiful MyEllevate after we removed a little bit of fat with our liposuction. She looks great on the table. Can't wait to see her one-day OVO results tomorrow. This is just 9 weeks after MyEllevate. This is a great procedure for patients in their 40s. Look at her jawline, look at underneath her chin, look how we were able to smooth that area, lift everything, improve her skin quality with the laser we use under the skin, and just give her this beautiful new jawline that she had 10 years ago. You can see as she looks upward, she has great contours, no visible scarring. Everything's done through little punctures, so there are no traditional incisions. We did this all under local anesthesia. Look at this one. You see that skin fold under the chin? It's gone. This last view just shows you the muscles as we have the patients flex and relax the neck muscles. You can see they are just less visible, a more beautiful jawline, a great result.
So how was your recovery?
It was a breeze. I feel like the next day I was back to like normal, other than wearing, the chin strap. I was out walking around shopping.
So Kelly, what would you describe as your level of discomfort, if any, after the procedure?
I would say next to nothing. Literally, I felt completely normal. I wouldn't say that there was maybe a level 2 pain, if any.
Kelly, so how do you feel about your jawline today?
I love it. I feel like I feel more confident. I don't have that laxity underneath my chin area, and I feel like I look more refreshed and younger.